When and where I should start fertility screening. Hi, this is Dr. Keerthana, fertility consultant in JP Nagar, Bangalore. So many people come to me asking, Doctor, when and where I should start the fertility screening. So when we look into that, the first question is, when should you start screening for infertility? When a couple is having regular unprotected intercourse for a period of at least 1 year but still not able to conceive, then both the partners should come for evaluation with a fertility consultant. So in certain conditions, we ask you to come a little early, that is earlier than 1 year of trying. So such conditions will be like, first thing is, if the female partner is more than 35 years, then if unable to conceive after trying for a period of 6 months, you should come for fertility evaluation. Why is this? So as the female age increases, the egg reserve, egg quality and probability of normal chromosomes in that egg gradually decreases. That's why it's better to get evaluated earlier once your age is more than 35 years. And there are certain other conditions where earlier evaluation is required, such as if the woman is already diagnosed with endometriosis or decreased ovarian reserve, or if the woman is having prolonged irregular periods history, or having shorter cycles. Shorter cycles means less than 24 days menstrual cycle. So other conditions in men where evaluation is needed earlier are like any history of childhood trauma or infection to the testicular area, or any history of pain or swelling over the scrotal region. And then coming to how to do the fertility screening, where you should start. So coming to this, both the partners, women and men, should be evaluated simultaneously to check for the infertility causes. So when we see in the man, there is a single best and easy test to do to evaluate the fertility, that is the semen analysis. So here the male should give the semen sample, which will be studied under microscope by an andrologist to check for the sperm function, motility and everything. So how to do this semen analysis? So abstinence period of 3 to 5 days is required to give the semen sample. So and the men should collect the semen sample in a container provided by the andrologist. It is very important to do your semen analysis test in a proper infertility hospital with a proper well-trained andrologist, because it is very difficult to see the sperm function and motility correctly. Now, when we look into the woman part, various tests to detect the various causes of infertility will be available, which will be first is we have to see whether you are releasing egg on your own or not. That means whether you are ovulating on your own or are your cycles anovulatory. Few tests, like one of that is folliculography, where we do the serial ultrasounds in your menstrual cycle to see whether your follicle is growing, whether it has come to a stage where the egg inside it is mature, and whether it is releasing the egg on its own. So conditions where we find this anovulation, such as PCOS, endometriosis and in patients with diminished ovarian reserve. Next we have to check about the fallopian tubes patency. Certain tests like HSG or SIS will help us to understand whether your tubes are patent or not. Tubes won't be patent in certain conditions like genital tract infections or previous any abdominal or genital surgery or previous tubal pregnancy, etc. The next thing is evaluating your ovarian reserve, that is egg reserve. Certain tests like anti-Mullerian hormone or antral follicular count can be done to know about your egg reserve. Again, doing this anti-Mullerian hormone test is also very important to be done in a proper infertility clinic, as handling of the blood may change or falsely give false results for this test. And the final one is to check for any uterine or cervical structural abnormalities which are hampering your fertility. Conditions like uterine fibroids or polyps or some birth uterine defects may be the reason for your infertility, which should be evaluated. Overall, these are the most important causes and primary tests to be done to evaluate your fertility, and if further tests will be done based on whatever abnormality is identified. If you are having any of the signs of the infertility, you can visit your fertility consultant and can get evaluated. Thank you.